Good morning, everybody. Dr. Elsie Koback here with Dr. David Dull. So happy to have him here. I'm with Lead Physician again, the leadership program for physicians by physicians, helping physicians to thrive and find their purpose and passion in healthcare again. Dr. Dull, thank you so much for being on here again with us.
It's a pleasure, Dr. Coe.
Dr. Dull, you wrote an amazing white paper that I think this is appropriate for the times, learning lessons learned from COVID-19 pandemic and what we need to do going forward. We were having a conversation before we went on about how we didn't really learn from previous um, epidemics that we've had. Tell us about why you ended up writing this paper.
Yes, so the paper was written because we saw the trauma that physician leaders were experiencing as a result of this pandemic, and we wanted to learn from it. We wanted to gather those lessons learned so that the trauma that physicians and physician leaders and healthcare leaders were experiencing in this pandemic, they never had to experience again.
Right.
And it was tremendously rewarding.
Yeah. And you know what? I love the fact that, the right leaders, the great coaches, we learn from things that where we failed. And I know that, personally, and I know so many people we see on social media, we see on the news how we failed in so many ways. Not just physician, I'm just saying healthcare, the system itself. Where can we? So we're going to go through some very specific areas where we can learn. So, what are the lessons learned? What are your recommendations? And how should we prepare our future leaders and our current leaders?
Yeah, those are all great questions that we tried to explore in this paper. And, so just to give your listeners a little bit of background, this is a qualitative research project. We interviewed 16 C-suite physician executives from 5 regions of the country, and we posed questions around their challenges and the leadership competencies that were required prior to COVID, during COVID, and what leadership competencies and challenges do they see going forward after the COVID pandemic. And to your first question, what were the leadership lessons learned? Number one, we were ill prepared for this pandemic, and I don't think that comes as any surprise to your leaders, to your listeners rather. We didn't learn our lessons, the lessons that we should have from HIV, SARS, H1N1, and so we were ill prepared. Just in time supply chain management doesn't work in a chronic pandemic, and we need to fix that. And the leaders we spoke with really talked about how our lack of investment in public health over the last 2 decades has really decimated our ability to effectively respond to this pandemic. So that's lesson number one. Real simple. The second lesson that we learned is that the organizations that were successful in this pandemic knew how to build teams quickly and to effectively work in teams. And that is a theme that came through loud and clear, and something that leaders talked about building that capacity moving forward. The third lesson learned is we can transform healthcare. For years we said telehealth won't work. We can't do telehealth. And yet, in the span of 6 months, organizations went from less than 1% telehealth visits to over 60 or 70% telehealth visits. So we have the ability to be able to transform our healthcare system. And then lastly, the last lesson learned is that leadership is emotionally and physically demanding, that self-sacrifice is not always admirable, and that leaders need to build into their schedules, into their routine times for self-replenishment. They can't give what they don't have.
Right. Okay. So, what are your recommendations then? Those are really great lessons learned. And what should we do going forward?
Well, I think we need to do a number of things. I think we need to train physician leaders and healthcare leaders differently. Um, Over and over again, we heard that entering the pandemic, organizations did not have an adequate pipeline, particularly of physician leaders. Um, and so we need to open up the pipeline for physician leaders. We need to make physician leadership development more than just a checkbox. It needs to include didactic as well as experiential learnings. It needs to include the opportunity for progressive responsibility, so assignments that offer additional um, opportunities for responsibility and accountability. Leaders talked about coaching and mentoring has to be for more than just C-suite executives. We need to have coaching and mentoring pushed down into the organizations. And there needs to be a much greater emphasis on emotional intelligence. Some of the CEOs we talked about jokingly or kind of at least half jokingly indicated that their title was no longer CEO, Chief Executive Officer, but now it was CEO, Chief Emotional Intelligence Officer. Um, and finally, we need to incorporate disaster preparedness into the training for all leaders. Again, this just can't be the disaster management department and the C-suite. It's got to be all leaders.
Right. You brought up a great point before about lessons learned about building teams, um, and building and leaders. In the old sense, we think about dictators. We think about people who give orders and things happen just because of their ability to, because of the where they are on the leadership chain. But instead, we need leaders, like you said, emotional intelligence leaders, those who help the staff, those who help the employees to do what they need to do to help the patients. So it's a different mindset of building these teams to, as a leader, we're serving our employees to build teams so that we can effectively help patients.
Yeah, and that's exactly right. And over again, the CEOs and the chief operating officers and chief medical officers we talked to referred to leaders that they didn't even know they had in the organization. And so those informal leaders, those influencers who, when given the opportunity, stepped up, led the teams, and really provided crucial services to the patients and the organizations during this pandemic.
Right. And those are definitely things that we can learn. We're just never taught how to do that or even think in that way in training and in medical school and residency. So that's fantastic. So what would you say are the top recommendations in terms of developing our future leaders? What do we need to do now? I mean, it's not over. We discussed that the COVID pandemic still has areas of surges. We're seeing in Minnesota, in Michigan. We still, I mean, who knows how long this is going to go? If we need new vaccines every year, what do we need to do right now to develop our future leaders?
Yeah, so I think future leaders, let me talk first about what future leaders need to do, and then let's talk about top recommendations. So, future leaders, we learned, really need to focus on learning resiliency and well being skills. Like we've previously talked about, they need to learn how to build and work in teams. As physicians, in med school, we kind of learn working in teams clinically a little bit, um, but working in teams administratively and across departments is a little bit different. And so we need to really develop that expertise. Over and over, actually, one of the top 3 competencies pre-pandemic was effective communication. Going forward, that's also one of the top 3 competencies that those we interviewed identified as crucial, but but it's different. Before the pandemic, it was all about learning how to communicate in person, in large groups, in small groups. Now it's all about electronic communication. How do you communicate using Zoom meetings? How do you communicate in blogs? How do you communicate better with external stakeholders? And then finally, they need to get comfortable or they need to develop their skills in decision making when there's incomplete information. You know, we like to have everything in order before we make a decision as physicians, and that's great as a physician. But in a pandemic, there's incomplete information. So learning to make decisions with incomplete information. And so kind of with those competencies as a background, I think there are 4 things that physician leaders need to do to prepare for the future. And one is getting comfortable with ambiguity. We saw that throughout this entire pandemic, and we're seeing it now. Number 2, they need to understand and learn disaster management. Multiple physician executives that we talked to became the incident command center leader for the entire pandemic. So they've been doing this now for over a year. 3, they need to hone their emotional intelligence skills. And 4, they need to develop their external networks. One of the things we heard from a number of physicians is they leaned heavily on their networks, both regionally, nationally, and some of them even internationally, to be able to develop best practices for their organizations.
Yeah, that's really, really good. I love the ambiguity part because as physicians, we need to have our ducks in a row. We are so used to having all the information given to us, and we've digested so much information about medicine in order to make a diagnosis. And so, how can we help patients? Is the way we think, and our culture is set so that we're not used to having ambiguity. Yes, there may be some uncertainty when it comes to diagnosing somebody because you don't know every single one of the facts, but we're so used to having so much in front of us before we make a decision. I need that CAT scan. I need this blood work. I need this ultrasound. We have to do this EKG before I can make a diagnosis. But instead, this is a completely different mindset. We have to know we have to make the best decisions what we have. We have to use the strengths of the employees that we have. We have to put together teams in ways we've never done before. A lot of uncertainty, a lot of discomfort, and learning to be comfortable being uncomfortable.
Yeah, exactly.
Those are such great points. How can we find this white paper of yours? Are you willing to share that right now, or are you going to be publishing it somewhere?
So we're absolutely willing to share it right now. If people would simply email me
Okay,
or go to my website and the contact page and request a copy, I'll be happy to send them a copy.
great. This is your email, correct, David?
Yes,
Okay,
yes.
David at compassexecutivecoaching.com. And your website is www.compassexecutivecoaching.com. Do you have any last words to say, David, before we end this? Thank you so much for this.
Yeah, so there I think there are 2 last comments. One came from a CEO out west, and he said that in a pandemic, organizations need to be able to switch from an abundance model where we usually operate to a scarcity model. And I think that shift in mindset is really critical. And then probably the most important, or one of the most important findings, was that the way we trained for disasters was completely ineffective for this disaster. We train for acute disasters like a hurricane or a tornado. This is a chronic disaster, and we need to incorporate into our disaster management training and drills scenarios that don't go away in 5 days or a week or a month, but disasters that drag on for a year or more in order to be well prepared for this next pandemic, which will come. It's just a matter of time, I think.
Right. And we shouldn't be, but it shouldn't be by default that we find those one or two leaders by accident who end up being great influencers during a pandemic. It should that we need to train each and every one of the key leaders in different sectors, not just at the C-suite, but within different departments of our organizations to make sure that we're all ready and we all have great ideas. Let's come together. Let's together figure this out. And we need to share amongst the different lessons learned. And I love that you interview these people across 5 different regions. I think it's brilliant. I think we need to continue sharing and continue implementing and applying lessons learned. Thank you so much, Dr. Dahl. Appreciate your time today.
Elsie, it's always a pleasure to be with you. Thank you for inviting me.
Thank you. And if you're somebody who has something to share, please email me at info@drlcco.com. I'd love to hear from you and help share the words of things that we need to learn for leadership in healthcare and for physicians. And please check out our website, leadphysician.org, for upcoming leadership program experience for physicians by physicians. Thank you, everyone. Until next Sunday, please have a great week and stay safe. Thank you, David.
Goodbye now.
Bye.